And there's
Hello, everybody. Welcome to our Tuesday evenings, where we're going to just pick up and continue from where we left off last week. And I have muted everybody, but if you are wanting to share anything later when I'm done or in between, you're welcome to stop me and ask questions. If we can just keep questions to around about a minute at a time, that'll be great, or even stories about a minute at a time, that will be great. But as I said last week, we are going through the messy part of our bodies at the moment. So it's all to do with the elimination and where we exiting all the stuff that we put in the top. And as you know, what goes in has to come out. And by the time it comes out, it looks a whole lot different to what it looked like from when it went in, which I think is probably a good thing in a lot of cases. But last week we touched on constipation and how dangerous that can actually be. And only when I was going through this, I knew constipation was a problem. And if you've ever suffered from constipation, you know exactly what sort of problem it is, how uncomfortable it can be. But as we saw last week, it can lead to all sorts of other medical conditions. And as I said, I see a lot of those medical conditions in my office and also in hospital on a very, very regular basis, all due to a simple constipation. It's not simple, but it's a problem. So today we're going to go on to the next part. I'm going to share my screen over here. And we're going to shrink everybody down so that I can see what I'm doing over here. And just as a reminder, I cannot see anybody on my screen when I am talking and sharing my screen. So please, if there's issues, I won't be able to see you, but you're welcome to WhatsApp me or message me or get my attention somehow or other to slow down, stop, whatever. Okay, as we know, we're going through the book, Your Body's Sign Language, which is excerpted from Jim McAfee's book of the same title. And Jim McAfee is a registered clinical nutritionist. Today, we're touching on a thing called diverticulosis. It's a big fancy term and quite a common problem. And I see on our theatre slates on a weekly basis where our general surgeons are doing scopes. And this involves shoving a camera down the top or up from the bottom to check and see where the problems are with people's digestion, because the reason that they're there is because they're having a digestive issue, and it could simply be diet related. Diverticulosis is also something that can be very uncomfortable and can lead to all sorts of other problems. And this is a condition in which the small areas of the colon balloon out in pockets. And to put it into a more graphical sense, if you've ever seen a bicycle tube that's got a weak spot in it, you pump the air in and it suddenly develops this little bubble on the surface of the tube. Inside the tire, it's not a big deal. Outside the tire, it can be a big deal, but also that is a weak spot that can easily pop or lead to punctures or whatever. And this same sort of thing happens in our gut. And we develop these little balloon areas that can form problems. And they, long story short, but through a process of various different issues, it can lead to colon cancer. And these can become inflamed or infected. And this is a condition known as diverticulitis. And anything that ends with itis is inflammation. And one of the things that has come up over the years is we all know we need to have fiber. And as you'll see through this whole talk, we often talk about fiber. And one of the more common fibers that you will see in the shops is things like psyllium husk. Now that is an insoluble fiber, and it's a very good source of fiber, but if you happen to have diverticulosis, those little husks can either block up this opening, as you can see from my graphic, or cause the problem by cutting the wall of the gut. So be careful of that sort of fiber. It is fiber, and it is one of the fibers that we need, but it needs to be in conjunction with a few other things. Diverticulosis may be indicated by abdominal pain and sometimes tenderness in the lower left quadrant of the abdomen, although it can also have no symptoms at all. And this is what makes medicine such fun, because even like with the current virus situation, some people are horribly sick, some people die, and some people are infected and infectious, but have no symptoms at all. I've even known patients to have been walking around for about a week or more, and they didn't realize that they had a fractured ankle. And it's only when certain other signs and things came about because of the excess wear that now suddenly the symptoms were appearing. Originally, when they first injured themselves, there were no symptoms. And this can happen with a lot of issues. So this is why we have to be so tuned into our bodies and listen to anything that may be out of the ordinary. But diverticulosis frequently progresses to diverticulitis. So it starts off with a smaller issue and becomes an inflammation. And once there's inflammation, that's where the fun starts. And the inflammation can be life-threatening if the pockets in the colon rupture or become infected with bacteria. Our gut is extremely sensitive and doesn't like anything out of the ordinary. So anytime that, like, you have a burst appendix or you have a leak in the gut for whatever reason, that can be life-threatening, and it is treated as a medical emergency, and you need to get it sorted out as fast as possible. Because once that infection takes hold, it can spread extremely quickly. It's like a wildfire. Half the population of 60 plus in the USA has diverticulosis, and almost all of those over 80 are afflicted with this condition. And as we saw last week, that is mostly related to diet, because we'll talk about the SAD diet. And SAD stands for Standard American Diet, which, as we've seen, is extremely high in processed foods and extremely low in fiber. And Dr. Neil Painter found that the majority of his patients with diverticulosis who used a high fiber diet regularly avoided complications associated with this condition. And there we can clearly see how important a good source of fiber is in the diet, how essential it is, in fact. Wheat bran, providing you're not allergic to wheat, and other sources of fiber work effectively if enough is consumed. And we are needing anything between 28 to 35 grams of fiber on a daily basis. The Standard American Diet, or the SAD diet, will give you roughly about 8 grams of fiber on a daily basis. If you're diabetic, fiber is even more crucial, because the fiber mops up the excess sugar. And if you think of fiber like a sponge, you've got water on the floor, you put the sponge on there, squeeze the sponge, and it sucks up all the water. Well, fiber does a similar sort of thing to excess fats, excess sugars, etc., not only in the gut, but also in areas like the kidneys. And we need to avoid small seeds which can lodge in the pockets and promote bacterial growth. So things like poppy seeds or sesame seeds on hamburger rolls, things like your psyllium husk, that sort of small seed, it looks very small, but can cause a really, really big problem if it lodges in one of these little openings, the diverticula, and blocks it up or causes a problem. The suggestions: we need to eat an unrefined diet or maintain a regular intake of fiber for prevention of this horrible condition. And remember, there is not just one source of fiber. And when I talk to my patients and I tell them, you need to have extra fiber in your diet, almost invariably they'll tell me, oh, I have a lot of fiber in my diet. I eat my all bran flakes or wheat bix on a daily basis. And I've just got to sort of shake my head and say, that's great, but you're not getting enough. And you're not getting enough of a variety of fiber to help you. We've got two sources of fiber in our range of products. We have the fiber tablets, which work really, really effectively. And then we have the more multi-purpose multi-fiber blend. Apologies for the picture, I know it's of the old bottle or old can. But the multi-fiber blend, I feel, is a little bit more, I hesitate to say user-friendly, but I think it's more versatile in the fact that you can mix it with your shake, you can put it in a smoothie, put it in with your porridge, you can put it in with your yogurt, you can mix it in if you're baking your own muffins or bread, you can put the multi-fiber blend in that, and you're getting a very good source of multi-fiber in those things. And we're going on to something else called hemorrhoids, or otherwise known as piles. And this is the rectal and anal veins that swell and become painful and sometimes bleed. And I see this fairly regularly where people come in for surgery to have these things, to have their piles removed. Now, piles essentially are a form of varicose veins, which we covered a couple of weeks ago. And they can be really, really nasty and cause big problems. If anybody's ever experienced piles, you'll know exactly what I mean. And I've had some issues over there. If fiber intake is not sufficient, one can get these things very, very easily. Hemorrhoids can cause tremendous discomfort. As I said, if anybody has experienced this, you'll know exactly what I mean, because they can burn, they can itch, they can sort of block up that little area down there. And I know this is getting into delicate areas and it's not always a comfortable talk to talk about, but it's things that we need to be aware of. Nearly half the population of the USA suffer from hemorrhoids or piles. That is extremely scary. Anybody who has a highly processed diet or has a diet very high in processed foods, let me rephrase that, will tend to suffer from this condition. And I've seen some medical stories on Twitter and those sort of things where people say, you don't need fiber in your diet. And I must say, from a personal perspective, I tend to feel quite uncomfortable if I haven't had enough fiber during the week. And you feel bloated, you feel just genuinely uncomfortable. And you don't want it to get to the stage where you develop something like this. Women often develop this condition during childbirth, although this condition most frequently results from straining at the stool as a result of constipation. The reason it happens in childbirth is similar thing. That little person inside a mommy takes up an incredible amount of space, and they're little suckers and they put pressure in all sorts of areas. Those of you who have had children will understand exactly what I'm talking about. And thank heavens, I can't tell you from personal experience how it feels. But during labor and during normal childbirth, there's obviously a lot of pushing and pressing, and that's where these piles and things develop. Use of special preparations and suppositories does not address the underlying problem of constipation. So it's like putting a Band-Aid strip on a cut. It's treating a problem, but it's not treating the cause of the problem. And as I always say to my patients, I want to know what's causing the problem, because if I can fix the cause, generally the problem goes away. If you're just fixing the problem, it never goes away. You have a headache, for instance. You can take a headache tablet, but what is causing the headache? Is it you're not drinking enough water? Is it, worst case scenario, brain tumor? What is the cause of the problem? Sort that out or figure that out and treat it, and you've got taken care of the problems. And sadly enough, a lot of doctors, and I'm not saying all, but a lot of doctors, you go to them and you say, I've got a pain or I've got a whatever, and they investigate that little area and that's all. They're not actually trying to find out what's causing the problem. And it's only when the dishing out of the antibiotics and the pain medication and come back after 2 weeks or 3 weeks or 4 weeks or whatever isn't doing anything, that they will then refer you to a specialist who will try and then find out the cause of the problem. And this can be decidedly tricky, as we've seen already. Straining at the stool increases pressure in the rectal and anal veins by 2.5 to 3.5 times. That is a significant amount of pressure. And your vein walls are generally not that strong. This weakens the blood vessel walls, resulting in or aggravating existing hemorrhoids. So this will cause that little weak spot to balloon up more. And if you've ever played with a half-inflated balloon, you squeeze it, you see how it becomes bigger in one area. Well, think of your gut the same way. A similar sort of thing is happening. Now, regular fiber consumption prevents not only the development of hemorrhoids, but also the aggravation of an existing problem, because it's keeping your stool softer, more moist, really disgusting sore disease, but it's making it easier to get rid of that waste product without straining. Suggestions. Sounds very logical, sounds very easy. Avoid constipation. Easy to say, not always easy to do. People who are on chronic medications, specifically chronic painkillers, will often have chronic constipation because those sort of things tend to clog you up big time, regardless of the amount of water that you're drinking. We need to increase our dietary fiber. And if you are not getting your fiber from your diet, you need to boost it. As I said, we're needing between 20, I think it's 27, 28 grams to about 35 to 37 grams of fiber per day. Have a look at things like your Near Life Shake. Good source of fiber, but not that much. So between your diet, and we're talking things like peas are a very good source of fiber, beans are a good source of fiber, raw fruits and veggies are all good sources of fiber. If you're not getting enough fiber from those things, you need to supplement. My apologies if I seem to be dragging a little bit because I keep getting notices to say that my internet connection is unstable. You need to supplement with vitamin C and magnesium. Vitamin C helps your body to create collagen, which strengthens the vein and artery walls, amongst other things. And magnesium helps with the relaxation of muscles. Calcium causes a contraction, magnesium causes a relaxation of the muscles. And there's our vitamin C. As we know, we have a food-sourced vitamin C, which is significantly better than an ascorbic acid form. And it is also a sustained release, meaning that it'll stay in your system for upwards of about 6 hours, as opposed to most vitamin Cs that will simply break down in your system very, very quickly, because vitamin C has a half-life of 30 minutes. And we have a very good source of magnesium, which is vegan for people who are concerned about that sort of thing, and entirely vegetable sourced. So we have a very quick absorption of the magnesium, and you can feel the effects very, very quickly. I don't know how many people have used magnesium, but I've been really, really enjoying it, not just to get a boost of energy when I need it, when I'm going for a run or a cycle, but also at night. to help you sleep. Works really, really well in conjunction to your calcium and magnesium. Just be aware, however, there is an upper limit of magnesium to take, and a dose should not exceed 500 milligrams in a single dose. Our magnesium is roughly about 150 milligrams per tablet. And what you'll find in the calcium and magnesium is, I think it's about 300 milligrams of calcium and magnesium through 3 tablets. So just check the labels, check the strength of whatever source of magnesium you're having, that you don't overdose on it. Before I go into the next section, does anybody have any stories or questions about diverticulosis or diverticulitis? If you want to, just get my attention and I'll stop sharing for a second.
Sean, I was just wondering, for excuse my ignorance,
No.
this is not the same than the leaky gut syndrome.
Similar, but not quite the same, no.
Okay, okay.
If
No,
I
I
remember
was
correctly,
just
we're getting
wondering.
into that later. But yes, it's a
Thank you.
leaky gut is also a big problem, and it can cause just as big an issue, but it's not quite exactly the same.
Okay, thank you very much.
All right, let's go. Yes,
Sean, can I just quickly say something?
go for it.
Crohn's disease is not addressed here. There are so many diseases, I can understand that. Yeah, very I won't say similar to diverticulitis, but yeah, similar sort of thing, and inflamed bowel.
Massive inflammation.
Omega-3, amongst others, is very important for that, and even because there's inflammation, even with the diverticulitis.
Correct.
That is now apart from a better diet, the fiber, etc.
Very, very good. All right.
Crohn's disease is a terrible thing. It's
yeah, no, it's very nasty.
Very nasty. Yeah.
Okay, let's carry on over here. Right. Kidney stones. I don't know if anybody of you have suffered from kidney stones, but they can be nasty. Thank heavens I have not had them myself, but I know my wife has had them, and she was not a happy camper. They are small rocks or stones that form in the kidney, as well as in the urethra. And if you've ever seen these things, they might look small, but they can feel like massive boulders in there. And I've had people describe kidney stones as being a pain worse than childbirth. I cannot say that from personal experience in either manner, but yes, if you've had them, you will probably understand why. Kidney stones produce excruciating pain, which has been compared with the pain of childbirth, as I said. Okay, this will be the last one I'm going through because I see I'm running out of time. The kidney stones are more likely to form if there are deficiencies in or of vitamin B6 or magnesium. Sugar is also a culprit in stone formation, possibly because it tends to deplete the magnesium and the B6 in the body. Sugar is nasty, as we've said before. And you'll find that a lot of people who do tend to suffer from kidney stones drink a lot of sodas, which are high in sugar, and quite often juices as well, also high in sugar, but sodas specifically. Even professionals jump to the conclusion that calcium should be avoided when someone has kidney stones, although some research suggests that decreasing calcium intake may increase the risk of forming some types of stones. Interesting conundrum over there. The most common type of kidney stones are high oxalate. And oxalates are found in things like spinach, rhubarb, parsley, instant coffee, tea, beans, chocolate, beets, and chard. And this increases the risk of kidney stones. Avoiding calcium increases oxalate absorption and may increase the chances of developing this kind of stone. So you tend to lose out on a couple of different areas over here. The pH of urine might prove to be an important factor in nanobacterial growth and subsequent development of kidney stones. So if in doubt, check the pH of your urine, get it tested, go to your GP, go to your clinic, go to your physician, and let them check and see, because this is something that is not commonly known. Nanobacteria have been implicated in a number of conditions, and that includes heart disease, where calcification is involved. So it's actually quite a nasty little thing that's starting to creep in over here, which I was unaware of before. Smashing kidney stones with ultrasound may help temporarily, but could trigger regrowth of calcified deposits. And I do see in theatre, our urologist will often set up a system whereby they are crushing kidney stones with ultrasound, and you can actually hear it outside the theatre. It's quite interesting to hear. And once again, we're treating the problem, we're not treating the cause. The very existence of nanobacteria is still a subject of heated scientific debate. So there's a lot of this going on. They're talking about it and doing more and more research. So I think we'll see more articles about this coming out at a later stage. The discussion allows us to observe some rather remarkable similarities between such diverse health conditions as tartar formation on your teeth, kidney stones, fibromyalgia, and arthritis. It covers a broad area, and yet all similar. Nutrients of significance of these abnormalities include magnesium, vitamins B6, C, and D, and essential fatty acids, most of which are missing in a refined diet. The suggestions. Again, avoid sugar. I think we're starting to get the message over here. We need to stay as far away from sugar as possible. And remember, we often get attacked by hidden sugars. Those are the things that are hidden in things like processed foods, breads, etc. Read your labels if you're worried about sugar. And be cautious of avoiding calcium. We need calcium, but we don't need too much of it. Like anything, too much of anything is bad for you. Too much water is bad for you. Too much calcium is bad for you. But without either one of those, we've got a problem. And consider the possibility of an overgrowth of nanobacteria, nano meaning extremely small. So you're going to battle to find these things even under a microscope, and they might need certain cultures to be tested before they can pick them up. Do not consume high oxalate foods. So we've been through the foods now. Be careful of what you're eating. We need to supplement with a B complex, especially B6 and magnesium. And remember, we don't know how much B6 or B2 or B12 we need. So that's why it is always a good idea to have a vitamin B complex with all of the B vitamins in it. And your body, which is the expert, can take what it needs from there. And I think I'm going to stop that right there because I see we've only got about 4 minutes left. And I'll go through the next part next week. So this is going to take us a good couple of weeks to get through, unfortunately. But I do believe that the gut area, so pretty much from there down to your waist, is vital for all sorts of different things. So if there are problems here, there are problems throughout the body, because if your body is being poisoned by things in the gut, it's going to lead to all sorts of nasties, heart problems, cancers, etc. So by keeping the income and the outgoing area regular, you can avoid a huge number of other issues. And as we've touched on now, things like arthritis, fibromyalgia. Fibromyalgia is becoming a lot more common condition these days. And it's nasty because it's it's basically chronic pain and very, very difficult to control. Yet it's diet related, as are a huge number of other conditions that we are seeing more and more and more of. And it's quite scary. As I said, working in the medical field, I am fortunate, I think, because I get to see a lot of these things, but I'm unfortunate because it saddens me when I think that probably 60 to 80% of the patients I'm seeing, I shouldn't be seeing because their conditions could have been prevented if their diet was right. And I am very pleased to see that dietitians are becoming a lot more crucial part of the medical team. And the doctors are starting to refer patients a lot more to dietitians. And I'm very fortunate in that I've got at least one dietitian as a downline who I talk to on a regular basis. She helps me, I help her, and between us, we are hopefully helping quite a few people. Right, we've got about 2 minutes left. Does anybody have any questions? Please unmute yourself and ask away.
Sean,
Yes.
acidophilus
Yes.
also play a big role in so many of these conditions. Dr.
Correct.
Barry Bland, when acidophilus was launched, and the omega-3 salmon oil plus, he did a talk, and I have his DVD.
Mm-hmm.
And he swears by, okay, now I know diverticulitis is like a very special Crohn's disease, but your normal gut problems, like spastic colon, and maybe there are many others. There are many others.
Yeah, there's a lot of them.
He says he swears by acidophilus and the multi-fiber blend. Now we've got the all-natural fiber. He hammered on that. It was actually quite good, and he explained it so nicely how. So those are always two things that we must remember.
Correct.
Yeah, of course you know that, but I thought I will just mention what he said.
It's good.
He says that we could guarantee if you've got a problem with your gut, multi-fiber blend and acidophilus. But I know some things are a little bit beyond that. But I mean, there's inflammation.
Yes,
so on.
and in most cases, that would be your first go-to supplements to try and control that issue.
Yeah, and very much from the beginning to prevent.
Correct. And prevention is always a whole lot less painful than cure. Yeah. Right.
I know, prevention is the best cure.
We are going to be bombing out any second from now. So thank you, everybody. We will pick up and continue the next part next Tuesday. I think there is a near life meeting tomorrow evening as well.